Hey, thank you for joining us for an episode of the Medicine Mentors, where we interview leading physicians on the best tips, lessons, and pathways to mastery for aspiring physicians. Our mission is to learn from top mentors the most effective paths to mastery and fulfillment in medicine and to spread their knowledge. For this episode, we have the pleasure and privilege of learning from Dr. Anthony Back, one of the leading pioneers in the field of clinical communication. Dr. Back is a physician at Colorectal Services at the University of Washington Medical Center, co-director of the University of Washington Center for Excellence in Palliative Care, and a University of Washington professor of Oncology and Medicine, as well as an adjunct professor of Bioethics and Humanities. Dr. Back was the principal investigator for the Oncotalk interventions. He co-wrote Mastering Communications with Seriously Ill Patients and co-founded the mobile app VitalTalk for improving clinical communication skills. In our conversation, Dr. Back shared his masterful wisdom on the topics of developing communication skills, the essential types of knowledge for an effective physician, and among other topics, how to navigate a successful career path. Thank you for tuning in to this episode of the Medicine Mentors with Dr. Back. We hope you take advantage of Dr. Back's advice and resources for developing premier communication skills and excellence in service of the patient. Thank you so much for being with us.
Sure.
I know you're a world-renowned expert in the areas of physician-patient communication, humanism, palliative care. Could you share with us I know you have a unique story and a number of different things that you're involved in. Could you give the listeners a brief perspective so that's where we're coming from?
Oh yeah, you mean in my personal background?
Yes.
Yeah, so I kind of got into the space a little by personal circumstance. So when I was a sophomore in college, my mother died of pre-leukemia syndrome. It was kind of one of these funny myelodysplastic things. And so it suddenly put me in the position of figuring out, wow, now I'm going to have to figure out, how do you live? So I ended up feeling like I should read the great books, read the wisdom books. Mm-hmm. And so that's what I did for most of my college career. And I ended up writing a senior thesis about James Joyce and Virginia Woolf. It's about personal identity and narrative technique. And the reason I mention it is because what happened was when I eventually got into oncology and got into this kind of communication space, I started to read transcripts of doctors talking to patients, and it was exactly the same thing. It was like narratives about patients and how they thought about their illness and what their doctors thought about. And that's kind of what got me into the current work that I do.
What advice do you have for residents when it comes to communication, which is, I think, your forte?
One of the most important things, I think, is that residents should realize that communication is something you learn. It's not something you should expect to have been born with. It's not a flaw or some character deficiency in you. If you are talking to a patient or family member about some kind of big issue and you don't know what to say, all of us have learned by working on this issue specifically. And if you look at the research about how professionals who do really complicated work, how professionals learn expertise, it's very clear that there is a sequence and there is a way to do it. And I think when I was a resident, it was kind of assumed that it was just kind of charisma, you had it or you didn't have it, right? You're hot or you're not. Sure. And we treated people who didn't have it not well. They got talked to, the doctors were talked to, the residents and medical students and doctors were talked about in really pejorative ways that now I feel like did nothing to forward the cause of how do doctors deal with the stresses that their patients have and deal with the stresses on themselves. We didn't do anything to advance that whole dialogue. And I think it's only been now much more recently that there is this widespread recognition that you've got to figure out how to learn it. And there are ways to learn it. And so, in our research and in our work with VitalTalk, which is the 501c3 that we started to disseminate this work, we use all that research. But it's still percolating through the system. And I still meet a number of residents who are ashamed if they did something that wasn't good, that work in settings where it's commonplace for the attending physicians or older physicians to say kind of, not helpful things about themselves or their colleagues. I mean, even the anecdote in the plenary session from yesterday to the thing about Chemo Boy, there was this registrar from New Zealand who was talking about his experience with a patient who turned up their own infusion, right, and got basically shamed and humiliated by the attending physician, right? And the message there, which I wasn't excited about, was that this is how you learn. Like, the way you learn from patients is that you try your best and are inevitably shamed. And I actually think that's completely misguided. I totally respect that guy's story, but I didn't like that ASCO showcased that as the story of how you learn from patients. That's not how I learn from patients. Nobody learns under conditions of being shamed and humiliated. And in fact, it's anti-learning. And what it's led to is this whole generation of physicians, who are all the people who are my age, who have incredible defenses because they have spent so much of their career trying to protect themselves from being humiliated. So that's my long riff about communication.
I know that you've designed some unique tools to foster physician-patient communication, to acquire the skill of communication, or charisma, I guess, as you were alluding.
Not charisma, skill.
Yes, the communication. So, what are some simple things that residents can start to use from tomorrow in their daily practice?
So actually, for residents tomorrow, I would actually recommend that they look up our app. So there's an app that we developed called VitalTalk that is both on iOS and Android. It is basically a card flip app, and it takes a huge amount of the wisdom that we have learned in teaching physicians to communicate better, and it breaks it down into very small pieces. And the whole deal is that, as a resident, if you're thinking that I want to improve, you should take one thing and work on that and see if you can think about it once a day, right? Like, doctors and students, trainees, all of you are under a lot of stresses right now. Like, there's a lot coming at you when you're in clinic, so I wouldn't expect yourself to revolutionize the way you are in the world in one day. I would say work on it bit by bit. And the other thing I would say is, when you see a role model, a mentor who's actually good at this, you should glom onto them for at least a little bit and find out, how did they get like that? What did they do? What was their own career path in sort of learning that? Because I think that having role models, and they are around, is one of the most powerful learning things that's available to everybody. So those are the two things I'd say start with. And then look to see what the other kinds of learning paths that are possible for you. Because if it turns out you're in a place with great people and a lot of resources, then it's easy to see what the pathway is. If you're not, then you may have to look outside your institution. And so, when I was learning, it turned out that I didn't think that the people that I was learning from actually knew what to do. Like, I went to Harvard Medical School. I followed all these really famous oncologists around as a medical student and thought, wow, this is how they talk to people. And really realized that the existing medical technology about communication just wasn't what it really could be or what it should be. So don't be afraid to look outside your institution.
Sure. And learn from the experience of others and try to emulate.
Yes, and there is a learning pathway about how to learn skills in a stepwise way. Like, we've laid it out on vitaltalk.org. You can see a whole bunch of stuff there. And there are courses that you can use, and a number of faculty in our group are using these things all over the country. Like, UCSF has a big group of them, for example. But we've trained over 500 faculty around the country now who are in different training programs and different kinds of medical centers. So, yeah, look around.
One more thing I really wanted to discuss with you, Dr. Back. When it comes to wisdom in oncology, what do you think that means, and where does that play a role?
So when you talk about wisdom in oncology, what I think of is, how do you develop clinical judgment and skills as an oncologist that allow you to meet a patient where they are, assess and understand what's really important to that patient, and have the technical knowledge and skills to give technically excellent care, right? So those are three different kinds of things, right? You have to have skills to reach a patient. You also have to have the knowledge and skills about how to analyze the case and recommend something technically excellent. And those are two different kinds of capacities that you need to develop really specifically. And there is a kind of wisdom that comes with experience seeing patients who don't fit into any of the simple categories, where that is where you need a sounding board of other people to bounce them off of. And I know people my age who still have colleagues that they email about cases because, there's so much that's happening in oncology, like, 15 new drugs a month. It's a challenge for anyone to keep up with. And I think the question is how do you develop habits for yourself that allow you to become a lifelong learner? Because that's what you need to do to be an oncologist these days. And so, in a way, the wisdom is from the accumulation of your clinical experience, seeing lots of patients, and your sense of what's happening in the field, so that as you sit down with an individual patient, you can put those things together for the goal of treatments that really meet patients' deep values and offer them the best of the technology that's out there. I think the pitfall is it's so easy for oncologists to be just driven by the technology, to be driven by the new drugs. And there is this kind of mantra that is unspoken about no one should die unless they've had all the new drugs, right? And it's very seductive. And in many ways, it's what Big Pharma is interested in, right? Like that, we have all absorbed this message that we've got to do this. And yet, if we step back and look at what's really good for patients, it's a mixture of those things. I have this story when I was a fellow. I took care of a surgeon who had CML. At that time, the only curative treatment was a bone marrow transplant. And he had a bone marrow transplant and got CMV pneumonia, which at the time was fatal, and died. And we said, okay, we're going to put you on a ventilator. We're going to do all this. And we knew he would die. And, the expectation that you would survive that, it was unprecedented, anecdotal. And we didn't even ask him. Is that really what he wanted to do? He was from Connecticut. He was from across the country. He died on a ventilator. We never asked him. And in retrospect, I feel quite shamed that we didn't think enough to even do that. And it seems ludicrous in retrospect. But, none of my mentors did it. There was no dialogue out there in the world about it. And I think we did him a disservice. Now, 30 years later, I take care of people with GI cancers. I saw a guy with metastatic pancreas cancer. He was at our cancer center for a clinical trial because his son lived in our town. But, when he got through his clinical trial, which helped him for a while, right? Like he was a beneficiary and lived longer than average with metastatic pancreas cancer. When it got to when the trial wasn't working anymore, we said okay, what's important now? And what he wanted to do was he wanted to go back to his home in Idaho and fish. And so I have a picture of him fishing with his 2 sons and his daughter. And that's how he raised them. He took them fishing. It was their thing. And he did it with them a month before he died, right? And so his family remembers that in a completely different way than I'm sure my surgeon's family remembers his death, right? He was still their dad. He took charge of what he wanted his life to be like when it got to that point. And it's a very different way of using the knowledge I have as an oncologist to make pivotal decisions and help people with pivotal decisions about, how they want their care to go.
So as physicians, we need to take that time and that responsibility to make those.
Well, and that
decisions.
skill, it's not just about more time. I see physicians spend so much time talking to patients in such ineffective ways. I constantly have people say, well, I talked to them for an hour and this is what I wanted. And I'm like, wow, if you were talking to them for an hour, you were doing something wrong, because it's not a matter of time. It's a matter of skill. And if there's one thing I would want to leave you with, it's not just time. I mean, I get that time does factor in some way, but it's far more an issue of skill than time.
You're at the top of your field. What's the secret to getting there?
Oh, what's the top? So, you know what? Here's what I would say. I would say, keep paying attention to what gives you energy as you do the work. The people I know who do really interesting paradigm shifting work, they don't do it because they did it what they thought they needed to do to become famous. They did something because they found something, got really interested in it, and really pushed the envelope in a way that would change and influence the field. So I think the question I would say for residents is what gives you energy? Could you pay attention to that and figure out how to do more of that? And when I say what gives you energy, be careful that it's not just because as a resident you're exhausted and tired or burnt out or something like that. This is what gives you energy when you are really at the top of your game. What is the kind of work that you do that makes you want to do it?
Would that be the same thing like passion, or is there a difference?
Well, so it is a little bit about passion, but passion is not the only thing. Yeah, I mean, I think passion is one of those ingredients in the mixture. But as I look back on my career, I could have gotten interested in a couple of different things. And so I don't think there's only one thing you're passionate about. And I think as a young person in the field, it's not just about following your passion. You have to look at, what are the opportunities you have? Who are the mentors who you could really learn something from? That combination of the opportunities in front of you and your interests, that is what turns into a career. And most careers that I think are really interesting careers, they have many unexpected twists and turns. It's not about a simple ladder that you can predict that will add up to success.
The last question, Dr. Beck, what's one thing that residents from your personal and professional experience should remember for the rest of their lives?
Oh, wow, that's a lot. One thing I would like people to remember for the rest of their lives is that, honestly, the most important resource to sustain is you. You have to take care of yourself to do the work with patients and to do the work that is going to change the field. If you don't take care of yourself, none of the rest of this stuff will happen.
Well, Dr. Beck, thank you so much
for
such
so
an
welcome.
Insightful and energizing conversation. Thank you for hearing Dr. Beck's wisdom. He is one of the most precious resources in the field of medicine, and it was an honor to receive his wisdom. Remember, you can follow in Dr. Beck's path of communication mastery through visiting www.vitaltalk.org, where you will find everything needed to next level your knowledge and skill sets. Please subscribe to stay updated on our newest episodes featuring the insights of top physicians, and please do comment about your experiences to keep the conversation going. Thank you for joining us for this opportunity to learn from the masters of medicine.